Well, this weekend, friends, family, and community will get together to say a final goodbye to Maddie Kingsbury. Her family is hosting a memorial service on Sunday at 1 o'clock in the McCown Gymnasium at Winona State. It will be open to the public. It's also going to be live streamed for anyone who wants to pay their respects that way. Kingsbury's ex-boyfriend, Adam Fravel, is in jail, charged with her murder. And in the charges against Fravel for Maddie's death are details of previous domestic abuse. Twice in those charges, it details moments where Fravel put his hands around Maddie's neck. Strangulation is something so dangerous in the realm of domestic assault, and it was a focus of a group gathering today to learn how to see it in a situation and do something about it. That training happening in Minneapolis right now. 100 professionals in the medical field, law enforcement, the justice system gathered. Kaya joins us now to talk about what they're learning at that training. Hi, Kaya.
Hey, Jana. Experts leading that training say strangulation often serves as a last warning before a domestic violence victim is killed, and that those who strangle are more likely to commit mass shootings.
So the crime scene is very important.
A hotel conference room turned classroom for police and prosecutors from across the Midwest.
We don't spend enough time learning about strangulation.
As well as forensic nurse coordinators like Whitney Brothers.
I'm in the hospital on standby if a patient comes in reporting sexual assault who needs a forensic medical exam.
Those in her field say many patients don't report they were strangled during an assault, whether from shame or fear, or they didn't know because the strangle didn't leave a mark. But even no mark can mean huge health problems later.
Some people don't realize what's happening to them and how close they are potentially to death.
Hennepin Healthcare organized this week-long training, flying in experts from Alliance for Hope International.
We started to do this work as a result of 2 teenagers dying in San Diego back in 1995. At the time, I was in charge of our child abuse and domestic violence unit, and these 2 teenagers both separately called the police to report that their ex-boyfriends had just choked them. Neither one of those cases were prosecuted. So then it started a long journey to try to figure out, how did we miss this? Why did we miss it? And what do we need to do to fix it?
Extensive research led them to learn patterns of people who strangle.
Years ago, we thought that the man who punched a woman, slapped a woman, choked a woman, they were all the same. And then we figured out in our research that men who slap or punch women, they're idiots. Men who strangle women are killers. They're not the same. The rage of a man who goes after a woman's neck, it turns out, is the same kind of rage that ends up killing a police officer, the same kind of rage that kills children, the same kind of rage that motivates mass shooters across America.
And so one takeaway from this training is to ask survivors the right questions, because the more documentation, the stronger the evidence against a dangerous person in court.
What did you think was going to happen? That's a question that I don't often ask. And then also, what made it stop? To be able to come to a more specialized, specific training for strangulation will just help to add more tools in our toolbox and more ways to take care of patients and provide them with the best care that we can.
This training was made possible because Hennepin Healthcare secured a $1.5 million federal grant. It's good for 3 years, so that should mean more trainings and, Jana, hopefully more prevention.
Yeah, you and I were talking about this earlier. It's just downright frightening that that kind of training has to happen, but clearly it's needed.
Yeah, and then one other thing to add, they were saying for HCMC alone downtown that since 2017 there had been over 400 people reporting strangulation, but of course that means there were that many more who didn't.
Yeah. Kaya, thanks so much. Appreciate it. If you or someone you know, someone you love, someone you care about needs help, there are domestic violence resources out there right now. That number on your screen, 24/7. Give it a call. Use it if you need it.